Hi, I'm Dr. Rutuja from Parency IVF Hospital. Today we are going to discuss about a topic which is sad, but then it is important. After the baby is born, a lot of people say that we got to know that baby has a hole in heart. We got to know that baby has a problem in lung. We got to know our baby is Down syndrome, or we got to know that our baby had certain enzyme deficiencies, or sometimes we also get to know that baby was all fine when baby was born, but later on in first day, second day, third day, fourth day, baby expired due to unknown cause. So these reasons, why does this happen? Most commonly this reason happens because of not getting antenatal checkups and antenatal screening done properly. What do I mean by that? The most important are the 3 scans in your antenatal time. First is at the end of your 11th to 12 weeks, that is 11 weeks 6 days to 12 weeks 6 days of your pregnancy. You should do a thorough genetic screening of your baby, whether you have naturally conceived or you are conceived through IVF. You should do a detailed genetic sonogram during this time to rule out any risk of any trisomies like Down syndrome, Edwards syndrome, Patau syndrome. Not just that, when we do this genetic screening, we also do your quadruple marker or double marker depending on your age and the risk you are standing on. This will give you a cumulative risk of you carrying any genetically abnormal child. Along with that, it also acts as a predictor for intrauterine growth restriction of your child, for macrosomia, that is diabetes or any reason related to big for the gestation age baby, and third, preterm deliveries and pregnancy induced hypertension. So it acts as a predictor on which you can map your next 2 trimesters, that is next 6 months of your pregnancy. Any risk comes high during this screening, you can do something called as non-invasive prenatal testing, which can diagnose without even hurting your pregnancy and child in 99% of cases if the child is having any risk of genetical abnormality. Apart from that, next scan when we go to, that is a 5th month scanning, which is called as anomaly scan or TIFAC scan. This is a detailed scanning which is done by a fetal medicine expert to check whether every organ is appropriately formed for that age or that week of pregnancy. In this, we can detect majority of life-threatening cardiological disorders, brain abnormalities, kidney abnormalities, and many other. If you get this scan done with a proper certified fetal medicine expert, lot of things can be ruled out at this time itself. And if at this time any risk comes high, you can all, even if it is chromosomal or formational, still you can take a decision whether to continue pregnancy or what are the precautions or what are the surgeries which will be needed for the child when the baby is delivered. Like if there is a coarctation of aorta, if this is diagnosed antenatally in your 5th or 6th month itself, then you know that your child may become hypertensive early. So as soon as the baby is born, you can show it to a pediatric cardiologist and plan for a balloon dilatation of the coarctation, and you can have a baby who will have a healthy lifespan and without any complication and hypertension developing in early age of his life. This is called anomaly scan, which is the 2nd most important scan. 3rd important scan is around 28 to 38 weeks, which we called as extended anomaly and interval growth scan, and we also do color Doppler, that is study of blood flow from the mother to the child and the blood flow within the child when it is in the mother's womb. What does this scan do? This also should be done by a specialist who is registered and who is recognized to do these scans in a beautiful way. Yes, scan machine also plays a very important role. Better the scan machine, better is the vision, so you can diagnose even minute things very easily. So in this scan, because our baby's brain and heart are two organs which keep growing till the baby is 5 years old, means brain keeps on evolving till baby is 5, heart keeps on evolving till the baby is born and reaches 5 years of age. So at 28, lot of cardiac anomaly which we cannot diagnose at 5th month can be picked up after 28 weeks. Along with this, even the growth of the brain can also be calculated during this time to understand whether the brain development is happening properly or not. Blood flows are very important during this time because this will give you an idea whether patient should be given a trial of normal labor or patient has to be monitored regularly and has to plan an elective C-section. Because if intrauterine only, baby is not getting proper complete oxygenated blood for its proper growth, then there is something called as brain sparing effect which starts happening internally in the baby's body. Means oxygen is only provided to the vital organs, that is heart and brain. Rest other organs, right, intestine, bladder, kidneys, the blood supply is reduced, which is called as brain sparing effect in pregnancy. If that is being seen, which indicates your baby is already weak without any signs apart from the baby's weight is on a lower side. So blood flows give us an idea whether our baby will be having a good blood flow to give it a proper trial, because labor pain is the first trial which your baby is going to go through while coming in this world. Every contraction, the blood flow to the baby is stopped for those few seconds. So if baby is already compromised and if you push this pregnancy through a normal delivery deliberately, then there are very high chances that the oxygen supply is cut to the child for a longer period of time. And if God forbidden you have a little prolonged labor, then this child can have permanent brain patches which are damaged, which can lead to cerebral palsy. Baby can have permanent damages to the intestine which can later present as necrotizing enterocolitis, or it can also lead to premature lung failures, which they say that surfactant was less, baby was unable to breathe, etc., and even ventilators after the baby is born. So blood flow monitoring is very important after 28 weeks, and if it is not correct, it has to be frequently monitored till the delivery. These are the 3 most important scans which we should do before planning of your delivery. What and how to plan your delivery, whether C-section only or normal delivery, and what is trial of labor, please follow my next video. Thank you.
If you have any questions, connect with us on the displayed phone numbers or visit our website to learn more.